Health experts in Turkey say contact tracing, as well as cutting-edge hospitals and early treatments, are helping to keep the country ahead of COVID-19. Turkey has around 234,000 cases of the virus and more than 5,700 deaths. That means it's about 0.7 deaths per 10,000 people, which is lower than the UK's 6.95 deaths per 10,000. Well, let's speak to Dr. Irshad Shaikh, who is interim head of the World Health Organization's Turkey office. Thanks so much for joining us. Why does Turkey seem to be able to be managing so well?
Well, I think first and foremost, thank you for giving us this opportunity, and at the top of the morning to your viewers, and happy Eid to your Muslim viewers in the UK. I think Turkey situation, and it has managed well because they have crossed all the boxes and crossed all the T's in terms of testing, in terms of readiness for the virus. They had 3 months lucky break before the first case showed up in March, while the outbreak was getting slowly globally. So they had travel restrictions, they have surveillance at points of entry and airports, then they had the testing capacity in place. Contact tracing, as you mentioned very rightly, was the second in terms of the 3 T's. Testing, tracing, isolation, and quarantine. And one of the things that Turkey showed leadership in is also that the president made the COVID-19 an emergency and care for over 4.5 million refugees in Turkey and migrants also free of charge from the government. So in the sense, access, coverage, and utilization for COVID-19 was made available. And as you rightly said, case management from clinicians in Turkey also has many lessons for the world. And then, of course, in terms of mitigation, the government showed leadership from the front with risk communication and community engagement. President himself coming on the air, minister every week. Plus, they never hid minced words. If the cases were increasing, they were coming on the air and saying, we are seeing cases increase in this place. And when they relaxed, there was a clear and stark warning for the community that if you don't act responsibly in terms of wearing your mask, keeping your distance, washing your hands, if staying home when you're sick, then we will go back to restrictions. So I think all the stops being made by Turkey has really helped it to be where it is today. Nonetheless, I think yes, please.
So I was going to say, how confident are you, though, that the figures that are coming from the Turkish authorities are accurate?
I think that is a question that is being asked in every country, every government. What this virus has shown is that you may be able to hide for 2 weeks or 3 weeks, but if you hide the numbers, people show up in ICUs, in hospitals, and deaths. So it's very difficult to hide in the long run. And like I said, even where there has been minor increase, we have seen government coming in the front and giving the numbers and giving warning to its residents in that area, locality, or province. So again, it's very difficult. You may hide some cases for the start, but in 2-3 weeks, deaths and the rush and strain on the hospitals will catch up if we do not have any structured capacity to address all aspects of COVID-19.
Of all the measures that Turkey have taken, you talk about case management, track and trace, free testing, which do you think has been the most effective at halting the spread of the virus?
I think it will be difficult to take credit away from one segment to the other, but definitely testing played a very critical part. Contact tracing broke the back of the camel, if we can say. And then I think credit goes to the clinicians whose case management, though, in terms of therapeutics, in terms of using oxygen, putting patients on ventilators very late, giving them oxygen, a supine position. All these elements collectively made the dent in the cases where Turkey is today.
How fast do you think it will be before Turkey could potentially be COVID-free?
Well, I think there will never be a time, at least not in the immediate future, when a country would be COVID-free. We have to learn to live with this virus. Cases will go down. We may see up and down, slight upticks here and there, but constant vigilance, monitoring, and learning to live with this virus in the new normal is the way forward. There will never, hardly be a time where it's in coming months and years when we will say we are COVID-free, because even if we have a vaccine, to have a vaccine 98% effective like measles, we don't expect. Even if it's 50% effective, and the time it will take for the globe, because even if one country has low cases, the global trade, livelihoods, tourism, travel, economy, there will be so much movement across borders that unless globe is able to contain the virus, one country's own efforts individually will not play much part. So I think that is a fallacy. We need to learn to live with this virus by watching our distance, putting on your mask, washing your hands, and making sure that you are staying home when unless necessary, and definitely when you're sick, you must stay home.
Okay. Dr. Irshad Ali Shaikh from the World Health Organization, thanks so much for talking to us.